Inhabitants within Sabronum and its surrounding communities within the Havana Southeast District of the Ashanti region have over the years complained about a number of healthcare challenges they face. The Sabronum Health Center, which serves over 20,000 residents, lacks basic tools and enabling environment to ensure the provision of quality healthcare. The residents heave a sigh of relief when the Health Minister, Kwekwajuman Menu, last year cast sought for a polyclinic to be constructed in the area as their health center was going to be upgraded. Despite the fanfare, no significant development has taken place as weeds have grown in the area with no sign of actual work beginning anytime soon. As the management of the Sabronum Health Center and the residents are worried about the situation, the challenges keep getting worse each day. According to the management, one major challenge they face is congestion, as the population in the area keeps growing. With an increasing number of patients, however, there has not been a corresponding increase in health workers deployed to the center. This leads to pressure on the few health workers at the facility, as patients are not attended to early enough and are made to wait for hours. Speaking to City News, the Deputy Sub-District in charge at Sabronum, Franco Seusu, called on government to consider the needs of the facility as a priority.
The health minister was here, I think, in September 4th last year to cut the sod for commencement of the project. The contractor also came here, I think, somewhere in February this year, and promised us that in March 15 or in the middle of March, they will come and start. But currently, we've not seen anything yet. So we are also pleading on the right authorities to also see to it that it's being done, so that people around Sabronum and then the Sabronum community also benefit from the national cake. When the facility or the project is being completed, it's going to add more. I think the government or the stakeholders are going to bring in more staff from other fields to come and help to take care of our populates. Currently, we are in dire need of health workers. Like as I said, we have only 10 nurses of all categories, meaning community health nurses, enrolled nurses, staff nurses, and then if I should add even midwives to it. You see, we are serving about more than 20,000 people, and we have only 3 midwives. Out of the 3, 1 is on maternity leave, 1 is pregnant. So it's a big challenge to us as a sub-district or as a facility.
Another major concern the management wants addressed is the issue of backup power supply, as most activities come to a halt whenever there's a power outage.
Currently, we've been facing the challenges of power outages. I think it's a general thing in the country. And when there's power outage, there's no other alternative for power supply in our facility. So if stakeholders can also come in and help us with a plant, that when there's no light, we can fall on that plant and then supply. Because when there's a case in the night, being a labor case or an emergency case at the OPD, we have to use our torchlight, our phones. And since there's no light, our phones might also be going running down. The batteries might running down, so we can't get anything to attend to these people. Yesterday, for instance, we have to refer somebody, not because we cannot attend to the person, but because there was no light.
Some residents who have been at the receiving end of the numerous challenges facing the facility have also been speaking to City News.
Your hospital, our hospital, no. Your nurse phone, Womusha. Now, if it's maternity phone, so you're back when you're crying better than us, you be. You hear no marketing, because say, a dancer can nurse phone, or a ban boy, Nanka, pet, a danka crabby, a danka seer, a side of my ye. Your billet, ever has seen, Tiabano. Say hospital, say CB, at the kind. Now your billet, a nurse phone, who show a hand blade. Lights, so dear Juman, make us any call off. Dear Salaban is a warm wire. Your whole today was Sabronum. Nurse of one today, here be pa, Madame Barco pay maternity for 1 area. You better not hang no see a collar more, so still I am quarantine here about or why.
All what we are urging is that the authorities or the government have given it as a contract to somebody, they should look for that person to come in. And on the part of the government, what they're supposed to do, they should do it as early as possible for the contractors to come to site and start working. The short curtains is getting to 1 year, and nothing has been done. Look at the signpost that was pasted here for the short curtain. It's even broke down.
Problem I face is the break, especially a draw light off, and doom so. Bia odu be ba no this is so a torch because 3 days ago it will be ba no light off just a torch and sana doctor for no use esrema no die ha adwene pa ye be srempin for no say no say plant kura na generator kura number 2 hospitals be brama kono e doom light plant or na generator o
since the machines be dwie ye hunu hwe block kura bi na so anyo kura ma so ne ezi abetwa blocks ti ebesre omo modin so mbaba be ya mai eto su biom nurses no ba bi omo ti kura anye ko so omo do so adan omo titimu dan nusa jese bi ko hen ha da okurum na ekura yimu so da bo ayedin eso bi ti kurum na hwe popo yizo ana so nante mehwe obi anajo bra o say a problem jesre omo aban omo ye bo ayen.
After curtains sold here, work is yet to begin. And this is the major worry for the management of the health center here and the residents within this area. They want authorities to ensure work begins as early as possible. From Sabronum in the Hafano South East District of the Ashanti region, I'm Edward Upon Marfo for City News.